Welcome to Thursday's edition of COVID-19. Over 600 new infections have been reported in the country over the past 24 hours amid active vaccination efforts as authorities race to reach their target of 14 million people with at least one shot by the end of June. Now, we have more on vaccine-related news later on in the program. Here first is the broader pandemic coverage with our Kwon-Swa. So, just start us off then.
Sure, Sunny. Not a big change in the daily caseload this Thursday, with 681 infections reported as of 12 a.m. and that's 672 domestic transmissions and a single-digit figure in imported cases. Now, infections have been in the 600s for the second straight day, with a slight uptick this Thursday. And with that, the total number of cases here in Korea has surpassed 142,000, with 1,968 COVID-19 related deaths. And if we go over to our map now, we have over 200 infections in both the capital Seoul and Gyeonggi-do province. And the place with the third highest number of cases this Thursday is here, Daegu, with 74 infections, 73 of those being domestic transmissions. Now, the southeastern city, which was one of the worst hit during the earlier days of the pandemic, has reported the highest daily tally in more than 1 year and 2 months. And dozens of these new cases are stemming from a cluster infection at a bar.
Right, and we'll probably have to keep our eye on that for now. Thursday, that is today, Swa, is the last day of pre-registration for senior vaccination. But I understand authorities are leaving some opportunities open for those who may have missed the chance of early booking.
Exactly, Sunny. As of this Thursday, until 6 p.m. this Thursday is when people aged between 60 and 74 should have completed their application, with the reservation rate as of 12 a.m. standing at 77.6%. But after that deadline, the government is going to prioritize the elderly for surplus vaccines. So for more details on that, people in that age group and above will be first in line if they apply directly for surplus vaccines, either by calling or visiting designated vaccination centers. However, younger people aged 30 and above can continue to use the online and mobile services provided by Naver and Kakao Talk. This is part of the government's effort to first inoculate as many people as possible that are most vulnerable to the COVID-19 virus and at greater risk of serious illness or death. Authorities, meanwhile, have renewed their confidence in inoculating more than 13 million people by the end of this month, with now the vaccination with more than 13% of the nation's population having been vaccinated with at least one dose of a vaccine, with 6.7 million people. And on to other news, the Delta COVID-19 variant, until recently known as the Indian variant, has been detected in at least 62 countries, according to the World Health Organization as of Wednesday, which meanwhile downgraded 2 out of 3 lineages of the Delta strain, with just one remaining a strain of concern. And now let's move over to the global figures. We've got close to 500,000 new infections, and also here over 130,000 deaths in a day. But this could be seen as a tenfold jump. However, that is highly likely due to some revisions of death rates, total number of deaths in some countries around the world, and that includes Peru and Mexico, which we see here, which have revised their death toll here, 228,000, more than 184,000 here in these two countries. Meanwhile, Brazil is the country with the third highest number of cases, but has the second highest number of fatalities, followed by India. And those are the updates I have for now, but I'll see you back after the government briefing. Sunny?
Right, so thank you for now. Back on the domestic front, the academic arena is looking to further open its doors this month. For more on this, I have our Chang Taeyeon here in the studio with me. Welcome, Taeyeon.
Good afternoon, Sunny.
Right then, let's start with the latest at schools here in Seoul.
Sure. So starting from June 14, middle school students in the capital region can go to school more often. The Education Ministry announced on Wednesday that the attendance for middle schools in Seoul will be raised to 2/3 of their capacity from the current 1/3. The decision reflects the ministry's view that remote learning is not an ideal substitute for in-person classes. The education minister said student learning had suffered as a result of school disruptions triggered by the pandemic. Despite the partial resumption of in-person classes, the country has held only half of the number of face-to-face classes compared to a normal school year. Middle schools in the capital region were hardest hit by the attendance cap, facing greater restrictions in accordance to Level 2 social distancing. The pandemic has also affected the mental well-being of students, with more pupils reporting symptoms of anxiety and depression. But better days could lie ahead, especially for students at vocational schools, where they learn hands-on skills like auto repair. That's because students there will be able to attend daily classes as part of the eased restrictions later this month. I visited one of those schools to talk to some of the teachers, and this is what they had to say.
Especially in this kind of laboratory, we need an in-person class. Based on the online class, it is very difficult to deliver our instruction and training to the students.
Helping students obtain their certificates is our main goal as instructors. It would be beneficial if students can come early to practice and prepare, but that is difficult under the current circumstances. So as a teacher, I support the full resumption of in-person classes.
Right, and I'm sure parents like me support that too. Now, earlier, Theon, you spoke of the psychological repercussions of the pandemic, and I hear authorities have a plan to better address them too.
They do, because the mental health effects are continuing to snowball as the pandemic drags on. According to a survey conducted by Health Ministry this March, the number of people at risk of depression has jumped to 23% of the population this year, up from just 4% in 2018. Young people in their 20s and 30s were at the greatest risk, with nearly 1 in 3 showing early signs of depression. And the survey showed that women are more likely to feel blues and anxiety than men. So health authorities decided to offer online counseling services targeting young people. A 24-hour hotline and in-person consultations will also be available for those working at designated COVID-19 treatment centers. Patients who are being treated at these facilities can also receive counseling even after recovery if needed.
Right, that is comforting to do. Now, Theo, let's shift our scenery a bit here. Summer is around the corner, and I believe authorities are looking to boost prevention measures at the beach.
Absolutely. So health authorities are leaving nothing to chance, especially with beaches expected to welcome more people this year. Take a listen.
The number of beach visitors fell 60% on year in 2020. But this year, we're expecting a rebound in that number thanks to vaccinations. So accordingly, we have drafted a new set of preventive guidelines for beaches.
People can call a designated number on their mobile phones to check in, instead of using QR codes or handwritten visitor logs. A temperature sticker will be put on the visitors on their wrist or on the back of their hand to check for any fevers. If anyone has a temperature of over 37.5 degrees Celsius, the color of the sticker will change, and he or she will have to be isolated at a nearby community health center. Everyone is required to wear a mask at all times, only except when they're in the water. Visitors are also advised not to eat or drink, especially during the evening hours. People can check how crowded the beaches are in real time using platforms like Naver or Kakao. So it's best to use these services before hitting the beach and avoid places that are too crowded.
I see. All right, Theon, thank you very much for the coverage.
My pleasure.
Right, up next, we're poised to join the regular briefing on the COVID-19 situation here in Korea for this Thursday. Now, while we wait for that to commence, let's take a look at the incentives for those who have received at least the first dose of the COVID-19 vaccine and have witnessed the passing of 2 weeks. First, these individuals are excluded from the cap of 8 people for family gatherings. This means any family member who has received at least 1 dose at least 2 weeks prior will be exempted from the head count of 8 people for family gatherings. Secondly, access to senior welfare and activity centres is allowed, and for those fully vaccinated, recreational programs such as singing classes is permitted, as is the sharing of meals. Also, in-person visits to nursing homes is possible if one party is fully vaccinated. However, at nursing homes where the vaccination rate for the first dose stands at below 75%, a negative PCR test will also be required. Prior reservations are necessary, and no eating nor drinking is allowed during these face-to-face meetings at nursing homes. The briefing is about to start. We'll come back to you afterwards.
Good afternoon, ladies and gentlemen. Let us now begin our regular briefing for June 3rd, Thursday. As for some updates on the vaccination front, we have the latest as follows. Today, we have the booking for the vaccination appointments for senior citizens, and today is the last day. And currently, as for the booking, vaccination bookings, the rate of these bookings have now stood over at about 77.6%, with over 7.3 million people completed the process. And as for those between the ages of 70 and 74, we have the booking rate standing at about 80.7%. And please also remember that today is the deadline for the advanced booking. So if you haven't done so yet, we ask you to book the vaccine appointments. You can either do so by visiting in person the vaccination hospitals, and also you can do so via a phone call as well. And if you do not complete this process, you can only get your vaccine after the entire general public has been vaccinated. And starting from tomorrow, when there are surplus vaccines reported at hospitals, they also have the rather than the current procedure, we have these new systems to be in place, and they will be uploaded onto the Kakao and Naver platforms. And also, we will be switched so that we can have the daily reservations and sign-ups for these surplus bookings. And this is aimed at having a more efficient ways of managing and also boosting the convenience of those people who are giving out the vaccination and those who are receiving them as well. And as for the AstraZeneca vaccine, you can do so if you are over the age of 30. However, if you are also one of the senior citizens, that is, over the age of 60, having difficulties in utilizing these applications, you could also do so via phone call to these respective hospitals. And next, as for the vaccine supplies, the vaccine supply is currently carrying out as scheduled here in South Korea. And as for June 3rd, we have AstraZeneca vaccines, 853,000 more doses have been supplied. And also on the 4th of June, we also have been scheduled to have about more than 800,000 doses to be supplied as well. And we also have been in schedule to be supplied with about 7.3 million by the end of this this month, the first half of this year, that is. However, we have an increased supply of that, and we also have the additional vaccines that will be arriving here in South Korea as scheduled. And also, we are seeing some breakthrough cases. And right now, we have a total of 9 cases being reported. And these breakthrough cases means that after the inoculation of all of the recommended shots, you contracted with the COVID-19 infections even after 14 days of these final infections. And out of the people we have witnessed and analyzed here in South Korea, we have confirmed 9 cases. And as for the 5 new cases, all of them have been receiving the Pfizer vaccines, and we are seeing whether they have been infected with the new variant. So we are also carrying additional analysis right now. So regardless of the type of the vaccine type, you can also be subject to these breakthrough cases. So therefore, it is very important that you need to always wear your face masks at indoors even after inoculation. However, here in South Korea, the rate of breakthrough cases is very rare and also very low compared to other foreign countries. And considering the effects of these COVID-19 vaccines that have already been proven so far, we see that there are much more benefits of getting your vaccines. Vaccination can also help us to return to a state of normalcy, and it can also help us protect the safety and health of ourselves. So if it is your turn, we ask you to avoid any hesitancy, but get vaccinated as soon as possible. And this is a great effort to protect your health and that of the local community. And as for global outbreak, the weekly COVID-19 tally has seen a decline for the past 4 weeks. However, we are seeing a rise in the number of new variants. And we also have a relatively decline of 1 on-week decline from the previous week. And in India in particular, they have been seeing a decline in the new cases as well as fatalities after having its peak. And also, about 60 countries have reported the Delta or the new Indian variants. And also, we are also seeing in some countries the combination of the Delta and also other new variants. And also in UK, we are seeing an increase in these Delta new variants. And in Australia and in Japan, we are also seeing the local spread of this Delta variant. So this is why we need to take particular precautions. Nevertheless, as for major countries with a high vaccination rate, we are seeing a very clear decline of on-day tally. And this means that here in South Korea, in order to minimize our risks of infection and also return to pre-pandemic routines, we need to also continue to keep to our quarantine measures like social distancing while carrying out our vaccination drive. And as for the virus vulnerable facilities and high-risk group, especially at the nursing hospitals and long-term care centers, we have been looking at about these cases for the past 1 year. We have been looking at the new military entrance, and we have been looking at many other facilities like correctional facilities, and we have identified 500 confirmed cases. And we also identified 78 confirmed cases in the month of May, and we believe that this has been a decline of about 50 cases compared to April. And in Ulsan City, we have been also carrying out preemptive testings for high schools and middle schools, and we have been looking at about 18,000 people there. However, we have also aimed to expand these preemptive testings to Incheon and other areas, so forth. And this is aimed at also to protect the safety of our students. And we are also carrying out regular PCR testings for cram school faculty members as well. And as for the benefits, incentives, that is for those who have already received their vaccinations, if you have completed the vaccination, we will be exempting them from these regular PCR testings, and we will be alleviating these burdens on these people who have already received the vaccination. And as for the R&D, we also have more announcements, and our Public Vaccine Development Center at the National Infectious Disease Research Institute have been completed with the authentication of the biosafety level 3, and this means that we can also have the 6BL3 rooms, which is capable of dealing with these viruses like COVID-19. And we also have many other facilities that can also help us to develop these new treatments or have other in-depth analysis of these new infectious diseases. And we believe that our Public Vaccination Development Center has also developed and upgraded its facilities, meaning that we will also carry out full-fledged to support the vaccination development here in South Korea. And last but not least, we are seeing globally a decline in the daily tally. And as of today, we see that we will have about more than 200 million doses of the vaccines being rolled out globally. And here in South Korea, we also have high vaccination rate as well, and the vaccination is keeping up speed. And we once again want to appreciate the public for your continued participation and perseverance, and our senior citizens citizens have been booking their COVID-19 vaccination appointments, and this vaccination booking rate stands at about 77.6%. And so far, more than 6.7 million people here in South Korea have already been vaccinated. So we highlight once again, if it is your turn to get the vaccines, please get your vaccines in a timely manner. And moreover, as imagined and as hoped, we also see a decline in the number of fatalities as well as the critically ill patients. And in summer, we also have the season for the which is better for the social distancing. We believe that during these seasons, we can see the effects of these social distancing measures as well. And we need to continue to maintain and keep our infectious rate at a very low as it is right now. And right now, the reproduction rate is also on a very stable level. However, I would like to highlight once again. And as for the recipients, the seniors especially, as for the recipients of the vaccinations, we are asking and enabling them to return to silver facilities and welfare facilities for the seniors. And there are also more calls for strict quarantine measures like wearing face masks. And at nursing hospitals and long-term care centers, when you carry out in-person visits, and also when you are at the silver services centers, please wear your face mask at all times. And if you have any symptoms, please do not go to these centers, but you need to get tested as soon as possible. And until the day we reach herd immunity here in South Korea, please abide by the basic quarantine measures. And as we overcome the COVID-19 pandemic, it is very important that we are on track to gain the COVID-19 sovereignty. And there are many heroes around us. They are the people who are working on the research and development, the scientists who are also keeping on to the research, and also corporations and other organizations and people who are in the sector developing the Korean homegrown vaccinations. And we believe that going forward, we can develop the homegrown vaccines and the mRNA platform as well. Thank you very much.
Right, there was Kwon Junuk with us, his afternoon briefing. So what did he have to say?
Well, Kwon first off reminded seniors aged 60 to 74 that the reservation for that age group for vaccination comes to an end this Thursday. But he noted that they can continue to apply for surplus vaccines, as I mentioned earlier. And Kwon also had some updates on breakthrough cases, as 5 new breakthrough cases in the country were reported, which means that people who were infected with COVID-19 2 weeks after being fully vaccinated. And the latest 5 people have received the Pfizer shots. And further analysis is going to be made on which strain these people were infected with, whether they could have been infected with variant cases. So with that, Korea has a total of 9 breakthrough cases, but the official noted that this number is pretty low compared to other countries abroad, emphasizing that the benefits of getting vaccinated outweigh the risks.
Of course. All right, so as always, thank you for that.
Thank you.
Right, up next, cryptocurrency. Now, even before the pandemic, it had a faithful following of individual and institutional investors. And life in the midst of COVID-19 appears to have raised crypto-related interest. We tell you why.
The price of Bitcoin touched an all-time high on April 14th. On that day, the price of 1 Bitcoin surpassed 80 million Korean won, or more than $72,000 US on local cryptocurrency exchanges. The meteoric rise of Bitcoin and the broad rally in other cryptocurrencies have been viewed with much alarm by Korea's financial regulators.
비트코인 가격이 왜 이렇게 비싼지를 잘 이해하기 어려울 정도로 저희들 판단하는 척도를 볼 때 지금 비트코인 가격의 좀 이상급등 아닌가?
Cryptocurrencies are digital assets that are based on blockchains, otherwise known as encrypted ledgers. Cryptocurrencies typically make use of decentralized networks and are not issued by central banks and other state financial institutions.
보통 일반적으로 암호화폐 정의는 3가지 요소로 구성이 돼요. 첫째는 뭐냐면은 우리가 함께 P2P로 발행을 하려면은 이제 P2P라는 그 블록체인 기술이라는 게 필요하다는 거고, 두 번째가 화폐의 그 진위 여부를 확인하기 위해서 이제 암호 기술을 쓴다는 게 하나가 있습니다. 자산이라는 걸 디지털로 전환이 됐을 때 그때 그 전환된 디지털 자산의 가치를 표현을 해줘야 되잖아요. 그래서 암호화폐의 가장 핵심이 뭐냐면은 바로 디지털로 전환된 자산의 가치를 표현하는 방법이다. 그래서 이제 암호화폐가 가치가 있다고 생각하시면 됩니다.
The booming cryptocurrency market has attracted many retail investors looking to strike gold. In April, more than 2 million users signed up for membership on Korea's 4 largest crypto exchanges, compared to only around 20,000 in March of last year.
일단 뭐 과열돼 있는 건 사실이고요. 우리나라 같은 경우에 이제 MZ 세대로 대변되는 2030 세대가 내가 이제 뭐든지 하지 않으면 어떤 부를 이룰 수 있는 기회를 박탈당할 것 같다. 이런 어떤 심리적인 불안감에 의해서 더 이런 투자들이 늘어난 것으로 보여집니다.
Korea isn't the only country where people are jumping on the cryptocurrency bandwagon. The exponential rise in trading volume in major crypto exchanges across the world is clear indication that the crypto wave has gone global. And according to experts, the COVID-19 pandemic may have played a crucial role in fueling the latest boom in digital coins.
코로나 사태 이후에 전 세계적으로 뭐 미국을 중심으로 우리나라도 마찬가지지만 굉장히 큰 유동성의 공급이 있었습니다. 코로나는 위기를 극복하기 위해서 전 세계적으로 대응을 한 거죠. 코로나 시대를 살다 보니까 컨택트 문화, 디지털 문화에 점점 익숙해지고 그러면서 비트코인 등 암호화폐에 대한 수용성이 굉장히 늘어난 게 아닌가 그런 생각이 듭니다.
The cryptocurrency market cooled off and went through a large correction as the calendar turned to May. The pullback in crypto prices was also triggered following moves by China and the US to tighten digital currency regulations. Despite the emergence of bearish market sentiments, new investments are continuing to flow into digital tokens.
본인이 투자하는 암호화폐가 건전한 건지 아니면 좀 불건전한 건지도 좀 알아봐 주시고, 그 다음에 남의 얘기만 듣고 묻지마 투자를 하지 마시고, 그 다음에 고수익을 보장한다는 거는 거의 다 사기성 화폐라고 생각을 하고요.
세상에 안전한 투자는 없습니다. 호주머니 가지고 있는 화폐도 인플레이션이 생기면 가치가 줄어드는 거니까요. 그래서 개인이 과연 자신의 모든 자산을 어떻게 배분하는가, 결국 개인의 책임이죠.
The persistent buzz surrounding cryptocurrencies is likely to spark further debate on what the future holds for these digital currencies.
외국 등과 비교해 볼 때는 낮은 수준이지만 혈소판 감소성 혈전증에 대한 감시 체계를 강화하고 전문 학회와 협력을 통해서 조기의 진단과 적절한 치료 대응을 강화하도록 하겠습니다. 얀센 백신은 미국에서 1,050만 명 정도가 접종을 진행한 백신입니다. 미국의 접종자 중에는 주한미군도 포함되어 있으며 약 5,200명이 얀센 백신을 접종하였으며 보고된 중대한 이상 반응 사례는 없었습니다.
For the first time since the start of public inoculations here in the country, authorities recently reported their first case of rare blood clotting in a man in his early 30s who had received the AstraZeneca vaccine. Now, for more on this very rare post-inoculation condition and other related issues, I have Dr. Kim Sing-taek from Institute Pasteur Korea. Welcome back, Dr. Kim.
Good afternoon.
And I also have Professor Yu Byung-uk from Suncheon University. It's good to see you again, Professor Yu. Meanwhile, I also have Professor Monica Gandhi at the University of California, San Francisco, joining this session virtually. Pleasure to see you again, Professor Gandhi.
Thank you. Thank you.
Right, Professor Yu, we'll start here in the studio then. Let's begin with the symptoms that may indicate blood clotting with low platelet count post-inoculation.
Well, this is the vaccine-induced immune thrombocytopenia. These words mean usually thrombus is started because even we are healthy men, we take the flights to the long distance from like Incheon to the Los Angeles, California, within the economy class. It can be happen to anyone, but the symptoms usually happen like swollen legs, paining, or sometimes in serious cases, short breathlessness, and the chest pain, a dizzy headache. It can be happen. But these cases, this immune reaction make the shortage of the platelets, but it producing the more thrombus is quite rare cases. But the symptom is quite similar what we know about the common thrombosis. So right after the 5 to 30 days after the vaccination is the vector basis like Janssen or AstraZeneca manufacturers one. If you have any symptom like the swollen legs, paining legs, and the short breathlessness, the chest paining, and unusual stomach pain, and the nausea, headache, mild dizziness, you must be reported and should be see the specialist.
Right. And because of such concerns, Dr. Kim, of blood clotting over viral vector vaccines, these are being offered to those above 30. But Korea's first case of very rare blood clotting involved a man in his early 30s. Should we be readjusting the age bracket?
I don't think only just the first case. This is the first and the single case. Do not just change out just the current guideline. The AstraZeneca vaccine was actually approved by the WHO and the EMA without any just restriction. But certain countries actually impose some restriction based on some ages, like sometimes 30, 40, or even just 60 or just 50. But then I think, but in this case, we do not. There's no reason to just suddenly change based on just a single just occurrence. And I think just current guideline is actually established by just referring to the some UK cases. And the UK has actually reported, I think probably just the most, just AstraZeneca, the vector, just this virus vector vaccine cases. So based on such kind of a huge, just not trial, but the cases, our just government, KDCA actually determined this 30, age of 30 as the some guideline.
Right. Meanwhile, Professor Gandhi, back in April, U.S. health authorities briefly halted the use of Janssen vaccines amid similar fears of rare blood clotting. Could you tell us a bit about this event?
Yes, I mean, it's true that both the Johnson & Johnson vaccine and the AstraZeneca vaccine are the same type. They have an adenovirus vector, and then that brings in DNA. And it does look like it's very rare again, but it does look like the mechanism is similar for both, that either the vaccine, the vector around the vaccine, or the DNA itself causes basically anti-platelet antibodies. Platelets is what helps us form clots, and it forms anti-platelet antibodies, and we can have this very rare disorder of vaccine-induced thrombotic thrombocytopenia. Again, very rare, 1 in a million here in Johnson & Johnson in the United States, 1 in a million actually less than 50, and 7 in a million cases over 50. So that's how rare it is as compared to COVID-19, which of course is much more common. But you're right, it is linked to the same thing that's happening with the AstraZeneca vaccine, both equally as rare, but likely very linked to the vaccine.
So specifically speaking then, Professor Gandhi, how many cases of rare blood clotting have been reported in the US among Janssen vaccine recipients?
So at this point, we've had about 15, and they're mostly in women, and they were between the ages of 18 and 50 almost exclusively. There was just 3 women above that age. Then just recently, a man, actually at our own institution, was reported with a blood clot in his leg. So it really is rare, but it has been reported that many times as we've rolled out Johnson & Johnson, which we've given out about 10 million doses at this point.
Right. Now, Professor, you're keeping in mind what Professor Gandhi has just said. Now, cases of these rare blood clotting appears to be more common in women below 50 than in men. How do you explain this finding?
We don't have yet the clear reason can be explained, but we can suspect. First of all, the woman under the birth control is the hormonal the recipients. It can be have more the blood clots. It's the tendency of the blood clot, usually the woman little more than men who under the reproductive age, under the periodic cycle. This is kind of the true. And the second theory is it can be the related more immune reactions with the adenovirus vector virus in the women and the men, but we don't have yet clear the data and can be proven scientific evidence. But this, on the base is because the UK also reported a similar thing, but we can suspect still under the birth control, the response in the woman, young, more than men. That's why we are recommended to certain age, certain gender restriction should be gone until it's proven 100%.
Right. And despite these concerns, though, Dr. Kim, reservations for the Janssen vaccine offered to Korea by the US were fully booked in less than a day. How do you explain this reality?
Yeah, just what a surprise! I mean, for me, and providing that Janssen vaccine was actually agreed by between the U.S. and the Korean summit meeting, and then that was actually supposed to be just given to the Korean military forces. But most of the Korean the military soldiers, I say less than 30 years of age. So that so in fact, so that this Janssen vaccine cannot be just administered to those people. So instead, just keeping the agreement between the two, just the summits. So then the vaccine was actually administered to instead some reserve forces, which is mostly just over 30s. So I think those the people just just male, and then those people are sort of just a tendency to be more just free out after the vaccination, and also some other regions, for example, like some international businesses and also travel. And then this one of the advantage is that this single shot is just enough. So based on after the single shot, they can just sort of just freely just move around within domestically or even just some internationally. So that might just give some incentives for those groups of people get just vaccinated by the specific vaccine.
Right.
Yeah.
And staying with Janssen vaccines, Professor Gandhi, I understand they've been found to be quite effective against the South African, known as Beta now, and the Brazilian Gamma variants. Could you tell us a bit more about this?
Yes, I mean, it's important to remember that when we consider these variants, that there are two types of immune responses generated by all of these vaccines, including the Johnson & Johnson. And one is the B cell response, where you produce antibodies, and those are talked about a lot because antibodies are easy to measure. But the second immune response that's formulated by the vaccines are T cells. And T cells are actually very complex, and they attack multiple parts of the virus if they see it across the spike protein, even despite the mutations. What I mean by that is there's about 100 or so T cells that line up across the spike protein. So even if you have 13 mutations like the Delta variant, for example, or fewer mutations than that, you still have a lot of complexity of your immune response across that spike protein, and you're able to combat the variants. And we've seen that. The South Africa variant was actually predominant in Qatar by March, and that in the B117, which is the UK variant. And by March, the vaccine campaign still showed incredible efficacy against these variants. So I think that the variants are still something to track, but it doesn't look like they are able to evade the immune response.
Right, which is quite encouraging. Meanwhile, Professor Yu, German researchers recently claimed the method of vaccine delivery in the cells may be linked to rare blood clotting. Could you tell us a bit about this claim and your personal thoughts?
Well, can be the key of solution, can be preventing of the vaccine-induced immunological thrombocytopenia, because there are some common points between the Janssen one and also AstraZeneca one. Also, I can comment more about the Sputnik V. This is made from the chimpanzee's own or human being's adenovirus. This is we can call carrier. Carrier means the carrying with some informatics of DNA, which is the release DNA's informatic to help to make the immune system. The problem is that this carrier, this vector, sometimes this vector can be the aggravating and triggers about the systemic of the thrombocytopenic conditions can be. So the German research suggested if we can be corrected, some informatics can be prevented of these events. I agree about it. But I heard that the Janssen and Johnson one will be connected, will looking for any the correct the error, but this AstraZeneca one, they're being discussed but not yet. But this can be one of the key can solve it in the near future, and we can have it because virus vector basis vaccination, we have been vaccinated with the flu vaccination, so every year. So it can be help to the another prevention case of the thrombotic thrombocytopenia with case of the flu vaccination too.
Right. Professor Gandhi, what are your thoughts with regard to this claim by German researchers?
I actually think it's very interesting, and I had not, to be honest, had not thought about that possibility as a mechanism because the New England Journal paper that covered the possible mechanism of what happens with clots and the AstraZeneca vaccine postulated that the adenovirus itself had an effect on creating antiplatelet antibodies. On the other hand, we're still new to all of these vaccines, and getting a sense of different possibilities of the mechanism is important. So I will look into it and see if something as simple as a different way of administering would be very helpful.
Right. Now, Dr. Kim, Professor, you mentioned Russia's Sputnik V, which is also a viral vector vaccine. Have there been any reports of rare blood clotting with that vaccine that we know of?
According to some Russian authorities, that there's no blood clotting out of just a Sputnik V. But I think, as just Professor you said, all the Sputnik V and then AstraZeneca and then Janssen actually they are actually using the very similar type of just the platform technology. So there's actually just probably, I think maybe the very similar things might just come out after just the Sputnik V. But the thing is, all the Russian data is not really transparent at the moment. So I think just showing the data is very important. And then this blood clotting, this was not actually reported in the even just phase 3 clinical trials. That was targeted for like 30 or 40,000 people. But then the occurrence of this blood clotting is very rare in terms of like, as Dr. Gandhi said, it's just 1 out of just 1 million people, things like that. So based on the clinical trials, we could not see such kind of rare event. But traditionally, this adenovirus, especially when it's used as some vector, there is some known very rare blood clotting event for this adenovirus vector vaccine. And then earlier in the some blood clotting issues, some virologists, even just including me, just in the beginning just suspected like some spike protein itself because the first report came from the AstraZeneca. And then that time, as far as we know, the AstraZeneca vaccine, only the AstraZeneca vaccine uses sort of just a native sequence of the spike protein. But the other platform uses sort of just a different sequence, sort of just optimized. And then some technical term is some pre-fusion stable just spike protein. But only just AstraZeneca vaccine uses some native the sequences. So then people say, well, some virologists suspect maybe that's why. But then now just a case report of blood clotting from the Janssen vaccine. So there may be some common just a thread is, maybe just adenovirus vector. So then maybe that might be expanded to the other just a Sputnik V. And also another vaccine that is also being developed by the some Chinese companies that is also using the very similar type of adenovirus vector vaccine. So we will see.
I see. We'll have to wait and see then.
Sure.
Professor, you, regardless of the concerns we touched upon today, do remind us again about the importance and safety of COVID-19 vaccination.
Well, vaccine is only one way we can fight against COVID-19 this moment. We can imagine you have umbrella, so umbrella to help to prevent the wet. But under the storm, it cannot be 100%. But we still use umbrella because we know that helps even we are wet. This is the same. We have some report, some percentile of vaccination can be better, some percentile of vaccination can be less, so strong enough to cover. But anyway, we are under rainy season, let me say, in COVID-19, better to use the umbrella. Get the vaccinated, it will help you, definitely.
Right, and Professor Gandhi also extended the same question very briefly. Do tell us about the importance of vaccination at this particular moment in the fight against the pandemic.
Yes, I mean, there really is no other way to get us through this pandemic except for mass vaccination. Mass distancing, ventilation, testing, contact tracing, they were tools. But the solution to the pandemic is for us all to get immune to this virus, to achieve herd immunity. And so the risk of COVID-19 itself can cause blood clots, can cause so many manifestations of severe illness and have clearly caused death. And so it really is important to not be, there's very rare side effects of these, but to get everyone who is willing to please get vaccinated, because it is really the only way that we can get back to normal life.
Right. All right, Professor Gandhi, as always, thank you very much for your words. Dr. Kim here in the studio, thank you for being with us today. And Professor Yu, thank you for your words as well. Right, now we end this session with some food for thought. According to health experts, you have a greater chance of being struck by lightning, not once but twice, than suffering a blood clot from a COVID-19 vaccine. Thank you for watching.